take much. Yes, please. So whenever you are ready, do let us know.
I'm ready.
Okay. So if you have read and understood, considering it communication skill station, please begin.
Good evening. I'm candidate number 1. I'm a surgical trainee here, and I've been asked to meet you and counsel you. Can I know your name and age?
Yeah, I am Ahmed. I am 48 years old.
Good evening, Ahmed.
Good evening.
So how have you been
Yes,
doing now?
yes, I am waiting you since long time because I want to go to my home.
Okay, Ahmed. I hope you know your situation and your
I
condition.
don't know what I have. I just they bring to me from emergency, and I am here. I don't know why I am here till now. And I left my wife in home. She is a patient of cancer. I want to go home.
Okay, Ahmed. I hope you know that you have a 10th rib fracture, and even though now at present your vitals are all stable, your pulse rate, blood pressure, oxygen saturation, though it is stable, but your hemoglobin has dropped from 12 to 10. Since there are some rashes.
Why this drop? Please explain to me
Yes,
why
yes,
it's dropping.
yes, Ahmed. So since your hemoglobin has suddenly dropped from 12 to 10, we are suspecting that there may be an internal injury in your abdomen. So we are planning for a CT abdomen to observe or to diagnose what could be the possible cause of sudden drop of your hemoglobin. So I think it will be prudent that if you stay back and undergo CT scan to know the cause rather than going back to home.
Okay, why this drop? Why this? My.
Yeah, one possible cause is since there are rashes or abrasions on your left side of your tummy. So possible cause could be there may be some rupture of a particular organ, or there may be some bleeding in that region. Most probably splenic laceration or splenic injury.
What's the spleen?
As you know, spleen is a small organ in the left side of your upper abdomen. It helps
Mhm.
in body defense, and it helps in immunity of your body.
Okay, but also I have an appointment to work because I lost my work also. I don't
No.
have also financial
Y-
support.
y- Yes, we understand
Also,
your.
all of them is tomorrow. The appointment is tomorrow. I should go home today.
No, as Ahmed, as we understand, these are your pressing needs, but uh, now going against medical advice could be really dangerous or maybe even life-threatening for you. So, if at all the bleeding increases in your tummy, there may be still more drop in your hemoglobin. So, I
Okay,
think,
no problem. I want to sign this one.
mm,
I
but
want to sign this one.
yeah, yeah. So, later on, if okay, I will suggest you some danger signs or some signs. If at all you
Okay,
face
tell
that,
me what's.
you should immediately report to hospital. Okay, if
Okay.
at all you are having giddiness, okay, if at all you're feeling your limbs are pale, okay, if
Mm-hmm.
at all you're feeling any headache or anything like that, if at all you're
Mm-hmm.
feeling your heart is beating fast, okay, you
Mm-hmm.
should report to hospital immediately. Okay,
Mm-hmm.
and
Okay.
I suggest you do the scan of your tummy at the earliest possible time. Okay, so
Okay.
that way you would at least know what could be the cause of your sudden drop in hemoglobin. Okay.
Okay. Oh, give me this paper. I want to sign it.
Yes, I can give you the legal document you can sign, but you should know that this your I mean this is a very risky thing and you are doing at your own risk and despite medical advice.
Okay.
Okay,
Okay.
so
Right. What
Thank
was
you.
your wife's
Thank.
issue? Is it possible that we can resolve it? We can talk to your wife?
yeah, is it possible if I could speak to your wife and explain her the gravity of your condition and make sure that you stay back rather than going away?
Okay. If this situation is if you talk to my wife and she is agree, but also I want to go to this meeting, job meeting. It's very
Yes,
important for me.
but see, Mr. Ahmed,
They
yeah,
schedule it tomorrow.
yeah, see, Mr. Ahmed, nothing could be more important than your own life, right? So I think the job interview can also be postponed. If you want, we can provide you a letter saying that you had a life-threatening emergency need, so you had to be hospitalized, and thus, if possible, at a later date, this job interview can be had.
Or alternatively, it can be arranged online.
Yeah, as alternatively, it can be arranged online.
Okay, it's a good idea also this one.
Yeah, so Mr. Ahmed, so you decide to stay back, right?
After this discussion, okay.
So,
Okay, okay, okay,
Yeah, two options. Yeah.
okay.
okay.
I think also he can offer for the
Social services for your wife.
Yes,
Yes,
social service, or I can talk to the your work to reschedule your
yeah,
meeting.
yes.
For
That
the
is
wife,
right. Social
can social
services.
worker or
Yes,
the nurse if she is need
nurse.
any
Yes.
medication.
But patient will refuse all this.
Yeah,
yes,
yeah, they will refuse.
yeah,
Yes. And one more
And
thing you have to check
that
when talking to the candidate.
summarization and
Yes.
thank the
yeah,
patient.
yeah, yeah.
Competency check you have to do.
Yeah. Yeah. Yes, I understand from you, Dr.
So
Vaji,
I
that
hope you understand. Yeah, yeah,
I should look for sign of headache and tummy pain and pain. I will go to the nearest emergency. And the other thing, uh, uh, just this one. This I have a splenic rupture, and I should
yeah.
look for this sign, right?
Yes, yes. So I hope you understand, yes, your situation. So here is a 48-year-old male who had RTA with hairline fracture of 10th rib, left side, and he also had the abrasions over the left upper abdomen. His hemoglobin had suddenly dropped from 12 to 10. He was suspected to have a splenic injury, and he wanted
But
to.
summary, you're doing it to who?
So, do we have to summarize?
No, not
Summary
to
for
me,
the patient.
for the patient. So what we have discussed so far, you're going to summarize it to the patient, that whatever you've decided or discussed so far. So you're not going to
Yeah.
present it to
Right.
the consultant. It's
Okay.
just that you'll say, okay, all right, Mr. Ahmed, this is our discussion, the summary of our discussion.
Yeah.
And then thank you.
Okay.
Good.
So, should I summarize now or like what?